Each day in the UK, 10 babies are stillborn and 152 babies are born preterm. We have evidence that these figures can be reduced, and we know from a recent Lancet series that access to and quality of maternity care differs amongst ethnicities. A number of confidential inquiries and reports and our research has demonstrated the difficulties women have in speaking up about safety concerns in pregnancy and birth. I was awarded seed funding from King's Cultural Institute for the Reassure project, which tested as proof of concept whether the use of arts-based methods could actually enable pregnant women to share their safety concerns about life-threatening illness. This project brought together women, third sector organisations and health professionals, a creative writer and an animator to develop a short film. The film addresses social and cultural barriers and provides guidance for women on how to speak up about their concerns. The film has demonstrated impact, prompting a social media campaign led by Tommy's charity, with features on ITV and BBC News and over 250,000 views. This diversity, ethnicity and voice project follows on from the Reassure project. We know how vital it is to ensure minority as well as majority patient groups receive health information. Our participant group were mostly white British women, and we know that engagement in digital health is linked to social and cultural norms, and that community support networks influence uptake of new digital health initiatives. This project will test conceptual understanding and cultural relevance of this film for pregnant women in the South Asian community. It fits the discipline bridging scheme as it brings arts and social science together, and it builds on my previous experience working with arts-science collaborations, which demonstrated increased understanding of diversity, increased engagement and a sense of community and creativity. I'll be working with artists from the Attenborough Arts Centre and the East Midlands Centre for Black and Minority Ethnic Health. After securing university ethics approval, we'll use film as the visual aid and concept mapping as a method, and use focus groups and interviews to test the film's content, including notions of empowerment amongst this group, and also what are the best methods of delivery do the visuals and sounds of the original film hold up, and importantly, what are the best networks for delivering community support for the film. Our outputs will be public engagement events and also securing follow-on funding for any adaptation that's needed to the film, translation and dissemination. Importantly, this work will add to the poor evidence base on how best to change health behaviours in minority populations using targeted interventions, and lead to a long-term goal of securing Wellcome Trust money for digital and social networks and engaging diverse communities in safety.
Everybody hopes their pregnancy will be easy. But what if it isn't? Knowing what's normal for you makes it easier to spot changes that don't feel right. And if something feels wrong, speaking up is important. Others can spot changes, and they can speak up for you too. It's easy to worry about being a nuisance. Time waster, fuss about nothing, over-anxious, troublemaker, frightened. But really, what's the worst that can happen? We'd rather reassure you 100 times than miss a problem once. No one should worry about speaking up in pregnancy.